For years, we've known that Alzheimer's disease disrupts sleep, and in the last 5 to 7 years, we have new data that is showing that sleep disruption is not only a consequence of Alzheimer's, but it's also a risk factor, meaning that sleep disruption early in late adulthood or early young elderly could be a risk factor for Alzheimer's. And what our data is showing is that slow wave sleep, which is one of the different stages of sleep. We have REM and non-REM sleep, and slow wave sleep is one of the stages of non-REM sleep. When there is a disruption in slow wave sleep, there is an increase in amyloid beta production, which is a biomarker is one of the hallmarks of AD. So we believe that disruption of slow wave sleep could increase amyloid burden and in the long term increase risk for Alzheimer's. Interesting part about learning about this mechanism is that slow wave sleep is a stage of sleep that we can enhance using drugs, but there are new therapies that do not involve pharmacological therapy. You can increase the slow wave sleep using sounds or electrical stimulation. So this opens a new potential therapy for prevention of Alzheimer's, and this is very exciting. There's also a second finding that I reported in this talk, which is that we're also seeing an association between tau and sleep spindles. We are seeing that elderly that are cognitively normal, that have increased levels of CSF p-tau and t-tau, which are markers of neurofibrillary tangles, have decreased sleep spindles. Sleep spindles are a sleep oscillation that you observe in non-REM stage 2, which has been associated with memory and with a sleep memory consolidation. So our findings suggest that if you have increased neurofibrillary tangles, you have less sleep spindles, and this could be one of the mechanisms by which tau disrupts memory. We know that tau is associated with cognition much better than amyloid beta. When tau is increased in the hippocampus, it's usually correlated with decreased memory, and this association between tau and decreased sleep spindles could explain how this happens, and we think that's also very relevant. And again, sleep spindles can also be increased using sounds or electric stimulation, so we're talking about potential new therapies to prevent Alzheimer's and to treat some of the symptoms of Alzheimer's before dementia stage, and potentially new therapies for prevention. We also look at one of the most common sleep disorders, which is sleep apnea, and research in my lab has also shown that sleep apnea in normal elderly also changes AD biomarkers, and we have shown that normal elderly with sleep apnea show more change in amyloid biomarkers over time, and they have increased amyloid burden over time, suggesting again that sleep apnea increases Alzheimer's disease risk, and that treatment of sleep apnea could also delay the onset of Alzheimer's.